Welcome to Lesson 3.2 of the Grant Architect course. In our previous lesson, we distinguished between beneficiary problems and organizational needs. Now we go deeper, exploring how to understand why problems exist in the first place. Root cause analysis is a systematic approach to identifying the underlying factors that create and perpetuate social problems. Rather than treating symptoms, effective interventions address root causes. The 5 Whys technique, originally developed by Toyota for manufacturing quality control, has been adapted across fields including public health, social work, and community development. By the end of this lesson, you will understand how to apply the 5 Whys technique, recognize the difference between symptoms and root causes, and develop problem statements that demonstrate sophisticated causal thinking. Before diving into technique, we need to understand the distinction between symptoms and root causes. Symptoms are the observable manifestations of underlying problems. They are what we see on the surface, the presenting issues that draw our attention. Root causes are the fundamental factors that create and sustain those symptoms. They often operate beneath the surface and may not be immediately visible. Consider a medical analogy. A patient presents with a fever. The fever is a symptom, not the disease itself. Treating the fever with medication might provide temporary relief, but unless you identify and treat the underlying infection, the fever will return. In grant writing and program design, treating symptoms without addressing root causes limits your impact. A food pantry addresses the symptom of immediate hunger, but does not change the root causes of food insecurity such as poverty, unemployment, lack of affordable housing, or systemic discrimination. This does not mean symptom relief is unimportant, but the most transformative programs address both symptoms and causes. The 5 Whys technique was developed by Sakichi Toyoda, founder of Toyota Industries, as a problem-solving method for manufacturing quality control. When a defect occurred, engineers would ask why it happened, then ask why that cause occurred, continuing until they reached a root cause that could be addressed. The process is simple. Start with a problem statement, then repeatedly ask why that problem exists. Each answer becomes the subject of the next why question. The goal is to drill past surface-level symptoms to reach actionable root causes, typically in approximately 5 iterations. The number 5 is not magical. Some problems reveal their root causes in 3 questions. Others require 7 or more. The key is to keep asking until you reach a cause that is both fundamental enough to matter and specific enough to address. Stop when additional questioning becomes circular or reaches factors completely beyond your influence. Let us work through an example. The presenting problem is that youth unemployment is high in our community. First, why? Why is youth unemployment high? Because young people are not being hired for available jobs. This tells us something but is still fairly surface level. Second, why? Why are young people not being hired? Because they lack the skills employers require. Now we are getting somewhere. The issue is a skills mismatch. Third, why? Why do they lack required skills? Because local schools do not teach workforce relevant skills. The curriculum does not align with employer needs. Fourth, why? Why do schools not teach these skills? Because schools lack resources for vocational training and have no formal partnerships with local employers to understand current needs. We could continue asking why schools lack resources, which might lead to funding formulas, property tax bases, or state budget priorities. But we have reached a level where intervention is possible, creating school-employer partnerships and vocational training programs. Here is another example from healthcare. The problem is that residents in our service area are not receiving preventive health care. First, why? Why are residents not receiving preventive care? Because they do not visit doctors for routine checkups and screenings. Second, why? Why do they not visit doctors? Because available clinics have inconvenient hours, long wait times, and limited appointment availability. Third, why? Why are hours inconvenient and waits long? Because few healthcare providers serve this area, so demand far exceeds supply. Fourth, why? Why do few providers serve this area? Because Medicaid and Medicare reimbursement rates, combined with high uninsured rates, make the area financially unattractive for medical practices. Fifth, why? Why are reimbursement rates inadequate? Because state and federal policy decisions have prioritized other areas and populations. Now we see multiple intervention points. We could work on policy advocacy for better reimbursement, recruit providers with loan forgiveness incentives, establish community health centers with alternative funding models, or extend hours and reduce wait times at existing facilities. In reality, most social problems have multiple root causes rather than a single linear chain. When you ask why, there may be several valid answers, each leading to a different causal branch. Returning to youth unemployment, we traced one branch through skills gaps to educational deficiencies, but other branches exist. Young people may face employment discrimination based on race, ethnicity, neighborhood, or criminal history. They may lack transportation to reach job sites in other parts of the metropolitan area. They may lack professional networks and connections that help others find opportunities. They may face family obligations such as childcare that limit their availability. Each of these represents a legitimate causal chain with different intervention points. The implication for grant writing is that you must choose which causal chain your intervention addresses. You cannot solve everything, but you should demonstrate awareness that the problem is complex and explain why your chosen intervention point is strategic. Several pitfalls can undermine your root cause analysis. Stopping too soon means accepting surface-level answers that do not actually reach root causes. If you stop at young people lack skills without asking why they lack skills, you have not completed the analysis. Going too far means reaching causes so fundamental or distant that no intervention is possible. If your analysis concludes that the root cause is capitalism or human nature, you have gone too far to be useful. Find the level where intervention is feasible. Single cause thinking oversimplifies complex problems by identifying only one causal chain. While proposals must focus, your analysis should acknowledge complexity even as you explain why you are addressing a particular cause. Blame-focused answers identify who is at fault rather than what systems create the problem. Saying the root cause is that parents do not value education is not useful and probably not accurate. Ask why parents might not engage with schools, and you will find systemic factors that can be addressed. Root cause analysis is not merely an academic exercise, it should directly inform your intervention design. Root causes suggest solutions because the cause implies the response. If the root cause is a lack of job skills, the solution involves skills training. If the root cause is discrimination, the solution involves employer education or policy change. If the root cause is transportation, the solution involves transit access. Strategic targeting means addressing causes you can realistically influence. Your organization may not be able to change federal reimbursement policy, but you might be able to establish a community health center or recruit providers with loan forgiveness. Choose intervention points within your sphere of influence. Theory of change emerges from root cause analysis. You should be able to trace your logic from root cause through intervention to outcome. We know the cause is X, so we will do Y, which will result in Z. Multiple entry points mean different organizations may address different causes of the same problem. A workforce board might address skills training while an advocacy organization works on discrimination, and a transit agency improves transportation. Coordinated efforts across entry points can be powerful. Root cause analysis demonstrates to funders that you truly understand the problem you propose to address. This is a significant credibility builder. Funders expect applicants to understand the problems they address. A surface-level problem statement suggests surface-level thinking about solutions. If you have not deeply analyzed why a problem exists, funders may question whether your intervention will be effective. A red flag for reviewers is proposals that treat symptoms without acknowledging root causes. A food distribution proposal that never discusses why people are hungry misses an opportunity to demonstrate depth. Even if your program focuses on immediate needs, acknowledging the larger context shows sophisticated thinking. Demonstrating you have done the analytical work builds credibility. When your proposal shows evidence of careful root cause analysis, funders trust that your program design is thoughtful and strategic, rather than reactive or superficial. This constitutes a competitive advantage. Many proposals describe problems adequately, but few demonstrate deep causal analysis. Doing so distinguishes your proposal from competitors who have not invested in understanding why problems exist. When writing needs statements, incorporate your root cause analysis strategically. Structure your narrative to present symptoms first, then trace to causes. Start with observable data such as unemployment rate or disease prevalence, then explain why these conditions exist. This mirrors how funders and reviewers naturally think about problems. Use language that signals causal analysis. Phrases like this occurs because contributing factors include, research indicates that this results from, and underlying this problem are all signal that you are moving beyond description to explanation. Support each causal link with evidence. Do not merely assert that a root cause exists. Cite research data or expert analysis that supports your causal claims. Unsubstantiated causal assertions undermine rather than build credibility. Emphasize the causes your intervention will address. While acknowledging multiple factors, focus your detailed analysis on the causal chain your program targets. This sets up your project description by establishing that you understand exactly what needs to change and why. While the 5 whys provides a linear drilling technique, fishbone diagrams offer a visual method for mapping multiple causal factors simultaneously. Also called Ishikawa diagrams after their creator or cause and effect diagrams, these tools originated in quality management but apply well to social problem analysis. The structure places the problem at the head of the fish, with major causal categories as bones extending from the spine. Subcauses branch off each main bone. Common categories for social problems include people factors such as skills, knowledge, attitudes, and behaviors, process factors such as procedures, workflows, and systems, environment factors such as physical conditions, geography, and infrastructure, and policy factors such as laws, regulations, and institutional rules. The benefit of fishbone diagrams is visualizing multiple causal factors simultaneously. This is particularly useful during brainstorming sessions with colleagues or community members. You can then apply 5 whys to drill deeper into the most significant causal branches. Root cause analysis should not happen in isolation. Community members experiencing the problem often have crucial insights into its causes. Expert perspective comes from lived experience. People dealing with unemployment, food insecurity, or health challenges every day understand the barriers and factors involved in ways that outside observers may miss. Their knowledge is expert knowledge about their own reality. Community input provides a validity check on your assumptions. You may think you understand why a problem exists, but affected community members may correct misperceptions or add nuance. Testing your causal analysis against community knowledge strengthens it. Community members may identify additional causes you overlooked. Perhaps you focused on individual factors when systemic factors are more significant, or vice versa. Fresh perspectives reveal blind spots in your analysis. Including affected voices in defining problems is also ethical practice. Problems should not be defined solely by outside experts or service providers. Those most affected deserve input into how their challenges are understood and framed. We will discuss community-based participatory research in more detail later this week. Different funders have different interests regarding root causes, and understanding this helps you target appropriately. Some funders are primarily interested in addressing symptoms and immediate needs. Emergency food assistance, crisis intervention, and direct services address presenting problems without necessarily changing underlying causes. These are legitimate and important, and many funders support them. Other funders are specifically interested in addressing root causes and systemic change. They want to fund interventions that change conditions, not just respond to them. Understanding a funder's orientation helps you frame appropriately. Government funders are often interested in systemic or policy-level causes, particularly when funding comes from agencies with broad public mandates. Federal initiatives frequently target structural factors. Private foundations may focus on specific causal factors aligned with their mission. A foundation interested in early childhood development may fund interventions addressing that particular causal factor in multiple problem areas. Strategic alignment means matching your causal focus to funder priorities. If a funder cares about policy change, emphasize policy-level causes. If they care about individual behavior change, emphasize that causal level. Your analysis should be honest, but your emphasis can be strategic. Here is a practical exercise to apply what you have learned. Step 1. Select a problem your organization addresses. Choose something central to your mission where you have good knowledge of the issue. Step 2. Apply the 5 whys technique, documenting each level in writing. Start with your problem statement and ask why at least 5 times, recording each answer. Do not stop at surface explanations. Step 3. Return to each answer and identify where multiple causal chains might branch. For at least 1 or 2 why questions, identify alternative answers that would lead to different causal chains. Map out at least 2 complete pathways from symptom to root cause. Step 4. Examine your organization's current programs and determine which root causes they actually target. Are you addressing symptoms, intermediate causes, or root causes? Is your intervention point strategic? This analysis often reveals gaps between problem understanding and program design. You may discover that your programs address symptoms while leaving root causes untouched, or that you are targeting one causal chain when another might be more impactful. Let us summarize the key points from this lesson. The core technique is the 5 whys, a simple but powerful method for drilling from observable symptoms to underlying root causes. By repeatedly asking why, you move past surface explanations to identify fundamental factors that create and perpetuate problems. The key insight is that most social problems have multiple causal chains. A single problem may result from skills gaps, discrimination, policy failures, economic conditions, and cultural factors simultaneously. Acknowledging this complexity while strategically focusing your intervention demonstrates sophisticated thinking. For grant writing application, incorporate root cause analysis into your needs statements. Present symptoms with supporting data, then trace to causes with supporting evidence. This demonstrates to funders that you understand not just what the problem is, but why it exists, building credibility for your proposed solution. In our next lesson, we will explore the data hierarchy, beginning with national-level data sources. You will learn how to use CDC, Census, and Bureau of Labor Statistics data to frame the broad scope of problems before drilling down to local specifics.